একটা ব্যথা আছে ডান দিকে, হাঁটুর পেছনে আর সামনে একটা ব্যথা আছে, পায়ের পাতার এই পোর্শনটা। কোমরটা অনেক বছর হয়ে গেল, অনেকদিন ধরে ডাক্তার দেখিয়ে কোনো লাভ হচ্ছে না, পেন কিলার খাচ্ছি, কমছে, আবার ব্যথা হচ্ছে।
ঠিক আছে, done the Gonstead Chiropractic X-rays for Mr. Shah, and we have marked this X-rays. So what I can see is that on the right side there is a PIEX ilium. Basically the ilium on the right side has rotated backwards and deviated on towards the outside. And this is AS on the left side. This is the ASIN ilium, where the ilium on the left side has rotated forward and gone inside. And the whole pelvis as such is rotated towards the left. We do the pelvic motion at this motion palpation. Down per bottom, up, and down, and the left leg up, and down. Right leg up, all the way up, down, left up, down. You can see the right pelvis is stuck on the right side. The PSI is not coming down as much as it should on the right side. Pause. Arch করুন সামনে দিকে, arch করুন, arch করুন, neutral. So through motion palpation we can clearly see as he extends his lumbar spine, the whole lumbar spine is rotating towards the left side. So that means how do we decide which of this ilium to adjust, because the right one is forward rotated and the left one is backward rotated. We decide that based on the rotation of the lumbar spine, fifth lumbar spine. Whichever side the fifth lumbar spine is rotated is the side that we need to adjust the SI joint on that side. So SI joint on the left side is PIEX ilium. So we correct the PIEX ilium on the left side. So correcting an ASIN ilium on the left side. We'll correct a PIEX ilium on the right side. So we'll take a tissue pull from lateral to the medial, and then use the pisiform of my hand to create a clockwise rotation for the EX ilium. Once I get that done, all I have to do is a posterior to anterior thrust using a body roll. Post X-ray, post adjustment of the pelvis, we'll again do motion palpation for the pelvis just to see if we have made any difference in the pelvis. Down. So as you can see, before doing the adjustments, when he was lifting this right leg, this right PSIS, this side was not coming down. But after post treatment, if you just focus on my hand, right leg up, you can clearly see this thumb is coming down. Drop. That means we have restored some mobility on the right side sacroiliac joint. Same thing we'll do on the left side. Left up, down, right up, and down. Okay. Thank you. Okay, so this is his L5. We have done some correction for the pelvis, and now the next interest for us is the lumbar spine. So through the X-ray we can see that L5 is relatively normal, but L4 is posteriorly subluxed to a large extent. That probably is the reason for the cause of pain in his foot. So we'll have to address this. So this is his L4. Three components in this. First one is it's gone backwards. So that's the P component of that. The next component is it's rotated towards the right. If you can see, this is the mammillary process on the right side and this is the mammillary process on the left side. This is way narrow and this is wide and big. That shows the spinous process and the whole vertebra has rotated towards the right side. The third component is this. It's wedged to the right. If you can see, there is this line is a little tilted towards the left. So we'll have to address. We have to lift this. We have to address this problem. So three components. We'll have to push the vertebra from back to front. We have to get the vertebra rotated from the right to the center. And the third component is we have to address the open wedge of the disc on the right side. That's probably causing the right is we cannot adjust on the right side because the convexity of the lumbar spine is on the left side. So we'll have to do an process where we'll have to adjust. We have to adjust from the convex side. We can never do the adjustment on the convex side. I cannot bring this vertebra down from this side. I have to lift the L4 vertebra from this side because this is a rule in Gonstead chiropractic that all adjustments are done on the convex side of the curve. Okay, so we'll have to use a mammillary process contact. So this is the mammillary process of the vertebra. So we'll have to do a technique to lift this vertebra up, push it forward and bring back this rotated vertebra from the left to the center. We'll go to the process. So we're adjusting the L4 vertebra on the right side. Prone line adjustment for the same L4 vertebra, that's PIEX M. So the contact is on the mammillary process on the L4 vertebra.
ফার্স্টে আমার কিন্তু আমি অনেকটা রিলিফ পাচ্ছি, মানে যেগুলো আমি করতে অসুবিধা হতো বেন্ড হতে বা পেছনে ব্যাকওয়ার্ড বেন্ড করতে, অনেকটা হচ্ছে কিন্তু অতটা লাগছে না আগের মতো।